Blood is always moving. Every second, your heart pushes it forward, and every second, your blood vessels respond to that push. The pressure created inside those vessels is what we call blood pressure. I am Dr. Warren Hung. In this video, I am going to explain how your body regulates blood pressure under normal conditions, and then we will walk step by step through how to lower it naturally in a medically sound way. Think of your circulation like a closed plumbing system. The heart is the pump. The blood vessels are the pipes. The blood is the fluid moving through them. Pressure is created when the pump pushes fluid into a space that offers resistance. Three main systems determine how high or low your blood pressure is. First, the heart. The heart squeezes and pushes blood forward. The stronger and faster it squeezes, the more force enters the arteries. If the heart beats faster or harder, pressure rises. If it slows down or pumps with less force, pressure falls. This is the most immediate regulator. It changes within seconds. Second, the blood vessels. Arteries are not rigid tubes. They are muscular and flexible. They can widen or narrow. When arteries narrow, the same amount of blood must move through a smaller space. That increases pressure. When arteries relax and widen, resistance falls and pressure drops. This narrowing and widening is controlled by nerves and hormones. It is automatic. You do not consciously control it. Third, the kidneys. The kidneys regulate how much fluid stays in your body. Blood pressure depends heavily on volume. If you retain more sodium, which is salt, your body holds onto more water. More fluid means more volume inside the vessels. More volume increases pressure. If the kidneys release sodium and water, volume falls and pressure decreases. These three systems constantly communicate. When pressure drops, sensors in your arteries detect it. These sensors send signals to the brain. The brain responds by increasing heart rate, tightening blood vessels, and telling the kidneys to retain fluid. Pressure rises back to normal. When pressure rises too high, the opposite happens. The heart slows slightly, blood vessels relax, the kidneys release more sodium and water, pressure moves downward. This balancing process happens every minute of your life. Another important system involved is something called the renin-angiotensin-aldosterone system. That is a long name, so let me simplify it. It is a hormone chain reaction that begins in the kidneys. When the kidneys sense low blood flow, they release a signal. That signal leads to the production of a hormone that tightens blood vessels and tells the body to retain salt and water. The result is higher pressure. Under normal conditions, this system is protective. It prevents pressure from falling too low. Blood pressure regulation is therefore not random. It is a tightly controlled biological system designed to keep blood moving to the brain, kidneys, and heart at all times. Problems begin when this system becomes chronically overactive. When arteries stay slightly tightened for years, they begin to stiffen. When the kidneys retain slightly too much sodium for long periods, blood volume remains elevated. When stress signals keep the nervous system activated, the heart works harder than it should. At first, these changes are small. You do not feel them. There are no obvious symptoms. But the pressure inside the vessels slowly rises above what the body originally intended. Understanding this normal regulation is important, because when we talk about naturally lowering blood pressure, we are not talking about magic foods or quick tricks. We are talking about influencing these same systems, the heart, the vessels, and the kidneys in measurable, physiological ways. And before we can lower pressure safely, we need to understand what exactly has gone wrong in the system and why it stays elevated over time. When blood pressure becomes chronically elevated, it is rarely because of one single cause. It is usually the result of several small control systems drifting in the same direction over many years. Under normal conditions, arteries are elastic. They expand slightly when the heart pumps blood into them. Then they recoil, helping blood move forward. This elasticity keeps pressure stable between heartbeats. With time, especially after the age of 40, arteries gradually become stiffer. The inner lining of the artery, called the endothelium, produces less nitric oxide. Nitric oxide is a natural chemical that tells blood vessels to relax. When less of it is available, vessels remain slightly tighter than they should be. Stiffer arteries mean the same amount of blood creates more pressure. Imagine pumping air into a flexible balloon versus a rigid bottle. The rigid container builds pressure much faster. Large population studies, including data from the Framingham Heart Study, have shown that arterial stiffness strongly predicts rising systolic blood pressure with age. Systolic pressure is the top number, the pressure when the heart contracts. But stiffness is only one part. The kidneys also begin to shift their behavior. Many people develop what is called salt sensitivity. That means their blood pressure rises more than average in response to sodium intake. The InterSalt study, which examined sodium intake and blood pressure across multiple countries, demonstrated a clear relationship between higher sodium intake and higher average blood pressure levels in populations. When the kidneys retain even slightly too much sodium, water follows. Water always follows salt. More sodium in the bloodstream increases fluid volume. Increased fluid volume increases pressure inside the arteries. This effect does not happen overnight. It happens gradually, day after day, year after year. Another contributor is the nervous system. Your body has a branch of the nervous system called the sympathetic nervous system. This is sometimes referred to as the fight or flight system. It increases heart rate, tightens blood vessels, and prepares the body for action. Short bursts of sympathetic activation are normal, but chronic activation due to poor sleep, persistent stress, obesity, or untreated sleep apnea keeps vessels slightly constricted and heart rate slightly elevated. That raises baseline blood pressure. There is also the hormone chain reaction we discussed earlier, the renin-angiotensin-aldosterone system. When this system is overactive, it causes blood vessels to narrow and the kidneys to retain sodium. Medications such as ACE inhibitors and ARBs work by blocking parts of this system. The fact that these medications are effective tells us how important this pathway is in hypertension. Obesity plays a strong role as well. Adipose tissue, which is body fat, is not just storage, it is metabolically active. It produces hormones and inflammatory signals that affect blood vessel tone and kidney function. Increased abdominal fat is associated with higher sympathetic activity and greater sodium retention. Data from NHANES, the National Health and Nutrition Examination Survey in the United States, consistently show a strong association between higher body mass index and elevated blood pressure. Alcohol can also increase blood pressure when consumed regularly in higher amounts. The mechanism involves increased sympathetic activation and altered vascular tone. Sleep matters too. Inadequate sleep disrupts hormonal regulation, increases sympathetic tone, and interferes with nighttime blood pressure dipping. Normally, blood pressure drops during sleep. In people with chronic short sleep duration, that drop is reduced. Over time, these small shifts accumulate. Blood vessels become less responsive to relaxation signals. The kidneys retain slightly more fluid than ideal. The nervous system stays slightly activated. Hormonal pathways remain slightly overactive. Each shift alone might raise pressure by a small amount. Together, they create sustained hypertension. This is why high blood pressure is often called a silent condition. It builds gradually. There is no pain signal. Many people feel completely normal. But inside the arteries, higher pressure creates mechanical stress. Over years, that stress increases the risk of stroke, heart attack, kidney disease, and heart failure. Guidelines from organizations such as the American Heart Association and the European Society of Cardiology define hypertension based on levels associated with increased long-term cardiovascular risk, not based on how someone feels in the moment. Understanding what goes wrong helps us see something important. Natural methods to lower blood pressure are not random wellness strategies. When they work because they influence these same physiological systems: vessel tone, sodium balance, nervous system activity, and hormonal regulation. And now we can move from understanding the problem to addressing it directly, beginning with the first 3 natural interventions that target the kidney, the blood vessels, and body weight in measurable ways. Now we will begin the direct answer to the title. How do you naturally lower your blood pressure? Not with tricks, not with supplements marketed as shortcuts, but by influencing the exact physiological systems we just discussed. Here are the first 3 evidence-based natural interventions. 1. Reduce sodium intake. Sodium is the mineral in salt that affects fluid balance. When you eat sodium, your body holds onto water to keep the concentration of sodium in the blood stable. More sodium means more retained water. More retained water means greater blood volume. Greater blood volume increases pressure inside arteries. This is basic fluid physics. The InterSalt study, which analyzed sodium intake and blood pressure across 32 countries, found that populations with lower sodium intake had lower average blood pressure and less age-related rise in pressure. The DASH sodium trial provides even stronger evidence. In that randomized controlled trial, reducing sodium intake significantly lowered blood pressure in adults, especially those who already had hypertension. In practical terms, reducing sodium does not mean eliminating salt entirely. The body needs sodium. It means reducing excessive intake from processed foods, packaged meals, restaurant food, and preserved meats. Who benefits most? People who are salt sensitive. This includes many older adults, people with kidney disease, and individuals of African descent, who statistically show higher salt sensitivity in several studies. What is realistic? On average, sodium reduction can lower systolic blood pressure by about 5 to 6 millimeters Hg in people with hypertension, according to pooled data referenced in American Heart Association guidelines. It will not cure hypertension alone in most people, but it directly reduces one of the main drivers, excess fluid volume. 2. Increase potassium through whole foods. Potassium works in opposition to sodium. If sodium encourages fluid retention and vessel tightening, potassium supports sodium excretion and vessel relaxation. It helps the kidneys release sodium in urine. It also influences smooth muscle cells in blood vessel walls, encouraging relaxation. The original DASH trial, which emphasized fruits, vegetables, whole grains, and low-fat dairy, demonstrated significant blood pressure reductions even without medication. That dietary pattern is naturally higher in potassium, magnesium, and fiber. Increasing potassium through whole foods such as leafy greens, beans, lentils, avocados, and certain fruits improves sodium balance and vascular tone. Important boundary. People with advanced kidney disease must be cautious with potassium. When kidneys are not functioning well, potassium can accumulate dangerously. This is why individualized medical supervision matters. For the general population with normal kidney function, increasing dietary potassium is associated with lower blood pressure and lower stroke risk in multiple cohort analyses. Magnitude of effect? Dietary patterns similar to DASH can lower systolic pressure by approximately 8 to 14 mmHg in some individuals, according to results from the DASH trial. That is comparable to a single medication in certain cases. But again, it works by influencing kidney, sodium handling, and vessel relaxation, not by magic. 3. Reduce excess body weight. If applicable, not everyone with hypertension is overweight, but excess body fat is strongly associated with elevated blood pressure. Adipose tissue produces inflammatory signals and hormones that increase sympathetic nervous system activity. More sympathetic activity means higher heart rate and tighter blood vessels. Weight reduction reduces sympathetic drive. It also improves insulin sensitivity, which indirectly affects sodium retention. Data from NHANES consistently show that higher body mass index correlates with higher prevalence of hypertension. Clinical trials demonstrate that even modest weight loss, around 5 to 10% of body weight, can produce measurable reductions in blood pressure. The effect size varies. Many studies show reductions of approximately 1 mmHg of systolic pressure per kilogram of weight lost, though individual results differ. Important boundary. Weight loss is not a moral issue. It is a physiological one. And not every person with hypertension needs to lose weight. The goal is improving metabolic and vascular regulation, not chasing an arbitrary number on a scale. These first 3 interventions primarily target fluid volume through sodium balance, vascular tone through potassium and diet quality, nervous system activation through weight reduction when needed. But blood pressure is also influenced by how much and how efficiently your heart works, how your blood vessels respond to movement, and how your nervous system behaves during stress and sleep. We have addressed fluid balance and body composition. Now we move to 3 additional regulators: vascular flexibility, nervous system tone, and hormonal rhythm. These next 3 interventions directly influence those systems. 4. Regular aerobic exercise. Your blood vessels are dynamic. They respond to movement. When you perform aerobic exercise such as brisk walking, cycling, swimming, or steady jogging, blood flow increases. Increased flow creates friction against the inner lining of the arteries. That friction stimulates the endothelium to produce nitric oxide. Nitric oxide is a signaling molecule that tells blood vessels to relax. When vessels relax, resistance falls. When resistance falls, pressure decreases. Over time, regular aerobic activity improves endothelial function. It also reduces resting sympathetic nervous system activity. The heart becomes more efficient. Stroke volume, the amount of blood pumped per beat, improves, which allows the heart to pump effectively at a lower resting rate. Large analyses referenced in American Heart Association and European Society of Cardiology guidelines show that regular aerobic exercise can reduce systolic blood pressure by approximately 5 to 8 millimeters per second in individuals with hypertension. Important boundaries. Exercise lowers blood pressure gradually. It is not a single-session solution. Consistency matters more than intensity. Extremely high-intensity training is not required for blood pressure benefit. People with severe hypertension or known cardiovascular disease should begin under medical supervision. Exercise works because it retrains vascular tone and reduces baseline nervous system activation. It strengthens the regulatory system rather than temporarily masking the number. 5. Reduce alcohol intake. Alcohol has a dose-dependent relationship with blood pressure. In small amounts, its effect on blood pressure may be neutral in some individuals, but regular intake beyond moderate levels increases sympathetic nervous system activity and alters vascular tone. It also interferes with sleep quality, which indirectly affects blood pressure regulation. Meta-analyses cited in European Society of Cardiology guidelines demonstrate that reducing alcohol consumption in people who drink regularly can lower systolic blood pressure by approximately 3 to 5 millimeters Hg. Mechanism. Alcohol increases stress hormone release and impairs baroreceptor sensitivity. Baroreceptors are pressure sensors located in the arteries. When their sensitivity decreases, the body does not correct elevated pressure as efficiently. Boundary. This is not about total abstinence for everyone. It is about reducing regular high intake that chronically stimulates the nervous system. For individuals who do not drink, starting alcohol is not a blood pressure strategy. 6. Improve sleep and regulate stress physiology. Blood pressure is not constant throughout the day. It normally falls during sleep. This nighttime drop is called nocturnal dipping. People who sleep poorly or too briefly often lose this dipping pattern. Blood pressure remains elevated throughout the night. Chronic sleep restriction increases sympathetic nervous system tone and elevates cortisol, a stress hormone. Elevated cortisol encourages sodium retention and vascular tightening. Obstructive sleep apnea, a condition in which breathing repeatedly stops during sleep, is strongly associated with hypertension. Treating sleep apnea with continuous positive airway pressure, CPAP, has been shown in multiple trials to reduce blood pressure modestly, especially in patients with resistant hypertension. Stress also activates the sympathetic nervous system. Short-term stress is normal. Chronic, unresolved stress maintains vascular constriction and higher resting heart rate. Behavioral interventions aimed at stress reduction show modest but measurable blood pressure reductions in some studies, though the magnitude varies. Realistic magnitude? Sleep improvement and stress regulation may reduce systolic pressure by 2 to 5 millimeters Hg, depending on the individual and severity of baseline dysfunction. This may appear small, but remember something important. Blood pressure reduction is cumulative. If sodium reduction lowers pressure by 5 millimeters Hg, exercise lowers it by 6 millimeters Hg, and alcohol reduction lowers it by 4 millimeters Hg. These effects can add together. This cumulative principle is reflected in lifestyle recommendations from the American Heart Association and the European Society of Cardiology. We have now completed the full 6-step natural protocol. Reduce sodium. Increase potassium through whole foods. Reduce excess body weight when applicable. Perform regular aerobic exercise. Reduce excessive alcohol intake. Improve sleep and regulate chronic stress. Each step influences a different part of the blood pressure control system: kidneys, blood vessels, nervous system, or hormonal pathways. But not every person responds the same way to these interventions, and natural regulation does not replace medical treatment in all cases. At this point, a reasonable question appears. If these 6 interventions are physiologically sound, why do some people see large improvements while others see only small changes? The answer lies in variability. Blood pressure is not a single disease. It is a final number produced by many biological inputs. The dominant driver differs from person to person. Let us start with genetics. Family history matters. Data from large cohorts such as the Framingham Heart Study and UK Biobank show that blood pressure traits cluster within families. There are genetic variants that influence sodium handling, vascular stiffness, and hormonal signaling pathways. If someone inherits genes that promote sodium retention, reducing sodium intake may produce a larger effect. If someone inherits genes associated with arterial stiffness, diet alone may not fully normalize pressure. Genetics does not mean destiny, but it changes baseline sensitivity. Next is age. As we age, arteries naturally lose elasticity. Collagen content increases, elastic fibers degrade. This structural shift increases systolic pressure even when lifestyle is relatively stable. This explains why isolated systolic hypertension high top number with normal bottom number is more common in older adults. In these cases, lifestyle changes still help, but the structural component limits how much reversal is possible. Stiff arteries cannot become fully youthful again. They can improve in function, but not completely reset. Kidney function also matters. Chronic kidney disease alters sodium handling. When kidneys cannot filter and excrete sodium effectively, fluid retention becomes persistent. In these individuals, sodium reduction may help, but medical management is often required. This is why blood tests and kidney function monitoring are important in people with resistant hypertension. Salt sensitivity differs between individuals. Some people can eat higher sodium without large blood pressure changes. Others experience noticeable increases with small changes in intake. Intersalt and subsequent analyses demonstrate population-level patterns, but individual response varies. Body composition also influences response. In people whose hypertension is largely driven by obesity-related sympathetic activation, weight reduction may produce substantial improvement. In lean individuals with strong genetic predisposition, weight loss may not change pressure significantly because excess weight was not the primary driver. Hormonal disorders must also be considered. Conditions such as primary aldosteronism, where the body produces too much aldosterone, lead to sodium retention and elevated pressure. In these cases, lifestyle adjustments alone will not correct the underlying hormonal imbalance. Specific medical treatment is required. Sleep disorders are another example. If untreated obstructive sleep apnea is present, blood pressure often remains elevated despite diet changes. Once apnea is treated, pressure may decrease. Medication interactions also matter. Certain medications, including some anti-inflammatory drugs, steroids, and hormonal therapies, can increase blood pressure. If these remain unchanged, lifestyle efforts may appear less effective. This variability explains something important. Natural interventions are not an alternative belief system. They are physiological inputs. Their effectiveness depends on which mechanism is dominant in a given person. This is also why guidelines from the American Heart Association and European Society of Cardiology recommend lifestyle changes for all patients with hypertension, but do not suggest lifestyle alone is always sufficient. In early or mild hypertension, lifestyle changes may normalize pressure. In moderate to severe cases, medication plus lifestyle produces the best outcomes. There is also the issue of expectations. Many people expect dramatic drops in a few days. That is unrealistic. Blood vessel remodeling and nervous system recalibration take time, weeks to months, not hours. Even a sustained reduction of 5 to 10 mmHg is clinically meaningful. Data from long-term follow-up studies show that even modest reductions in systolic pressure significantly lower risk of stroke and heart disease over time. This means success is not measured by perfection. It is measured by direction and sustainability. Natural methods work best when hypertension is early or mild. The dominant driver is sodium excess, weight-related sympathetic activation, or low activity level. There is consistent implementation. There are no untreated secondary causes. They work less dramatically when structural arterial stiffness is advanced, kidney disease is present, hormonal disorders are untreated, genetic predisposition is strong. Understanding these limits prevents frustration. And it allows us to think about blood pressure control not as a single tactic, but as long-term regulation of multiple interacting systems working together. We have discussed the heart, the blood vessels, the kidneys, the nervous system, and hormonal signaling. Now we need to connect them. Blood pressure is not just a number on a monitor. It is the result of constant negotiation between fluid volume, vessel flexibility, nerve activity, and structural integrity of the arteries. When you reduce sodium, you lower fluid volume. When you increase potassium through whole foods, you improve sodium handling and support vessel relaxation. When you reduce excess body fat, you decrease sympathetic drive and inflammatory signaling. When you exercise regularly, you retrain the endothelium, the inner lining of blood vessels, to produce more nitric oxide. When you reduce excessive alcohol intake, you lower chronic nervous system stimulation. When you improve sleep and regulate stress, you restore normal nighttime dipping and hormonal balance. Each intervention touches a different control lever. This is important because hypertension is rarely caused by a single lever being pulled. It is usually several small levers shifted in the wrong direction. Natural blood pressure reduction works best when multiple small improvements accumulate. You do not need extreme change in one category. You need consistent, moderate improvement across several systems. This is how clinical guidelines frame lifestyle therapy. The American Heart Association and the European Society of Cardiology both emphasize combined lifestyle modification because the effects are additive. Now we must separate two ideas: symptom control and cause regulation. Symptom control focuses only on the number. If blood pressure is 150/90, the goal is to bring it below guideline thresholds. Cause regulation focuses on why it is elevated. Medication is often necessary. It directly modifies vascular tone, fluid balance, or hormonal signaling. In moderate or high-risk patients, medication reduces cardiovascular events and saves lives. That is supported by decades of randomized controlled trials. Lifestyle regulation works at the system level. It improves vessel responsiveness, reduces chronic fluid overload, lowers baseline nervous activation, and improves metabolic function. Medication and lifestyle are not opposing strategies. They often work best together. Another important concept is timeline. Blood pressure may fall within weeks of lifestyle changes, but structural vessel improvements, improved endothelial function, and reduced arterial stiffness develop over months to years. The goal is not a rapid short-term drop followed by relapse. The goal is stable regulation. You should also understand that normal blood pressure varies slightly between individuals. Guidelines define thresholds based on long-term risk data. The lower the sustained pressure within a healthy range, the lower the long-term risk of stroke and heart disease, provided symptoms like dizziness are absent. This is why regular monitoring matters. If you are implementing natural changes, track your blood pressure at home with a validated device. Measure at the same time of day. Sit quietly for 5 minutes before measuring. Consistency improves accuracy. If readings remain elevated despite structured effort, that is not failure. It is information. It may indicate a stronger genetic component, kidney involvement, or need for medication adjustment. Blood pressure control is not a test of discipline. It is management of a biological system. Let me summarize the core message calmly and clearly. To naturally lower blood pressure: 1. Reduce excess sodium to lower fluid volume. 2. Increase potassium-rich whole foods to improve sodium balance and vessel relaxation. 3. Reduce excess body weight, if applicable, to lower sympathetic activation. 4. Perform regular aerobic exercise to improve endothelial function. 5. Reduce excessive alcohol intake to decrease nervous system stimulation. 6. Improve sleep and manage chronic stress to restore hormonal rhythm and nighttime dipping. Each step is grounded in known physiology and supported by established clinical evidence. Some people will achieve full control with these measures. Others will need medication as well. Both approaches are medically valid. What matters most is sustained regulation, not temporary correction. If this explanation has helped you understand your blood pressure more clearly, continue learning with us. Long-term cardiovascular health is built through understanding and steady application, not extremes. We care about prevention, and we care about clarity.